showing their support, but obviously everybody from the city side who has taken the time to really not only appreciate the gravity and the importance of this situation, but to really familiarize yourselves with what is being offered and what we're proposing to the city as part of this partnership, as something that, again, and you heard Bob mention it, very, very, very few times you hear it, that is true, but this is a win-win situation. There is nothing about what we are going to be proposing here today that really has any kind of a drawback. Everything that we're proposing here today, again, transparency is the goal. Everything that we're proposing here today, the data that we're going to be using, the data that's been analyzed, the data that's going to be presented to you is from the city's own records, the city's own claims experience. All of our information is directly as a result of the information that's been provided to us in cooperation and assistance for these negotiations. The language that we're going to be proposing to you as part of the collective bargaining agreement is almost exactly similar, save for, again, the contribution amount numbers, obviously, because they're going to be different. But the terminology, the terms, the language is exactly almost similar to what has already been ratified. So it's not an initial proposal. Everybody in this room has probably been involved in as many negotiations as I have. It's not just kind of your opening shoot for the moon kind of an article. This is already a final ratified agreement that's been codified. So both parties, on the city side and on the union side, have agreed to this language. It's not something that we're just inventing or trying to put in here now with Tampa. These are models that have been proven. They have been working for over 20 years at the least in most cases, and they have proven successful. You heard Bob mention what is success. Success from our standpoint is exactly what he mentioned. It's a cost savings to the city. It's an improvement of efficiencies in the actual administration of the health benefits and the wellness programs. And it's greater access and affordability for those who are actually paying for this, for the employees and the participants and the beneficiaries of the trust who are receiving the benefits. The ultimate goal here is to be able to provide the city with a cost savings, which you'll see we have done. Provide the members, those insurers, with a cost savings, which again, you will see we have done. As well as expand the actual level of benefits and programs that are available. So we are, in all respects, accounting for economies of scale, we're accounting for improved efficiencies of administration, we're allowing for our members to have greater access to greater health care. Ultimately, finally. That's the goal I know that each of the unions wants, and I know that that's the goal that the city wants as well. In terms of the structure and how this is going to be presented to you, I have copies of a draft article, a joint article between both unions, the Tampa PBA and Local 754, that we're going to be issuing and providing over to you now shortly. The collective bargaining agreement, as you heard Bob mention, it is the first step. It is the funding source. Once we agree on the language of the collective bargaining agreement, it takes the city's liability and cuts it to this is all the city is responsible to do with respect to its employees, police department and fire department employee health care. We have to contribute X amount of dollars. It's specified in the collective bargaining agreement, and that is it. The city can take a step back. Their liability is ended. That's a significant point, and I think it's critical that everybody understands exactly what that means. The city is no longer have to account for these individuals. The city does not have to deal with the insurance business. The city does not potentially have to deal with a growing at least 10 to 12% OPEB liability on a year-to-year basis. These will all be taken off of your plate, opening up dollars and budget constraints that were otherwise present for the city. It will free up money on an individual, on the employee side as well, because they're going to be paying less. They're going to be paying less money. We can show you this. We can show you this with hard numbers. This is not something that we believe we can do. This is not something that we estimate we can do. We are taking the data that's been used, the historical data that's been used, the information that's going to be provided to you. We're trying to make it as apples to apples as possible. The recent RFP from the purchasing department that was issued for health and wellness facilities and services, our team took that RFP and we have responded with our model. And we can show you the difference between what has been proposed to the city already in real time and what we're going to be proposing. And again, I think you'll be happy to know, we are certainly happy to know, that we beat everybody. We have a better deal. Everything that we're trying to do here today is meant as an effort to get this done. This is something that both unions have been vehement about, have been adamant about, that this is something that needs to get done, and the contract, the collective bargaining agreement, will not be ratified without a health trust. This has been something that's been in the works for both the police officers and the firefighters for a number of years. And I think everybody has put in the time, the effort, the resources to really get this done and propose to the city something tangible, something real, something effective. We're not here to try and hide anything. Which not here to try and, again, reinvent the wheel. All the terms, the trust agreement, the collective bargaining agreement article, the plan of benefits, which I'll get into in a second, they've all been tried and tested. Everything that you're going to have before you has been done by other large metropolis cities such as Tampa. It has been done with other large employee bases such as we have here with the police officers and the firefighters. It has been done here with large and larger budgets than what we're talking about here. So again, apples to apples, oranges to oranges, everything that we're trying to present to the city today, and obviously our members are here as well, is in an effort to really go the extra mile and ultimately try and have you tell us, why doesn't this work? Because we honestly don't believe that there's a reason. Again, lower cost, improved efficiencies, better benefits for our members and for your employees. The collective bargaining agreement article, we specified it. It limits the city's liability and it specifies the contribution amount. The declaration of trust, which we've briefly mentioned, it's the, think of it as the shell, as the skeleton. It's going to establish, and the draft that we have before you, it complies with all Florida state law requirements for trust, as well as all federal and IRS guidelines for a qualified trust. As Bob mentioned, the trust is going to have its own employee ID number. We're going to have our own certification letter, a tax letter from the IRS. It specifies exactly who's going to serve as a trustee, how those terms are enumerated. It specifies exactly from the membership how those people are elected, how they're voted out of office, what authority the Board of Trustees has, what authority the trust itself has as an entirely separate legal entity. The plan of benefits, which we may have 1, 2, 3, depends how great we get. The plan of benefits is more the meat and the bones. I'm sorry, the meat of the situation. The plan of benefits is going to specify who, what, when, where, how. It's going to tell you what kind of benefits are available, who's eligible for those benefits, how you appeal those benefits, etc. Once we have established the contribution amount, and obviously once we've finalized the trust agreement, which is final in near form as you will see it today, the plan of benefits is the portion that you're going to hear our partners from Brown & Brown specify as to what's going to be allowed or afforded to our members as part of this health and wellness package that we're proposing. I just wanted to stop and see if there's any questions from anybody in terms of just the legal documentation, what's going to be presented to you, and any other background that maybe we can provide as a source or as to appease or hopefully appease your comfort level with exactly what we're proposing here today. No questions? Great. This is going to be even a smoother negotiations than I thought. It's good. At the end of all this, and I know that the decisions that we make are lasting and are critical. At the end of the day, both Tampa PBA and Local 754 really want to impart to the city that this is an opportunity for both parties, or all three parties, if you will, to really make a difference in their employees' lives and really provide something that will be affordable. As you all know, as we can all expect, healthcare It's not something that anybody, I think, has a firm grasp on, and costs continue to escalate no matter who's in office. This is a mechanism that's been tested and it's been proven to provide accessibility for our members with improved and lower costs for their families. I can't stress this enough, and I really wish, and I know I'm being redundant when I say this, but it's a win-win situation for all parties involved. There are lower costs available, our members receive better benefits, and direct access to those who make the decisions on their behalf. I have to run down to my briefcase to hand out. I'm going to hand out right now the draft article to everybody. I only have 10 copies, so I apologize. That's right. Now, what you have before you, again, the draft article that we have before you, we have tried to make this as user-friendly and as easy as possible for everybody involved. We're not reinventing the wheel. The article that you have before you, again, like I mentioned before, I'm sure the city has done as much research on this as we have. You can pull this information up. This is straight out of collective bargaining agreements that have been ratified, and you will see that the language is almost exactly similar to that has already been approved. We're not asking for more, we're not asking for less, we're asking for exactly what it is that we need in order to make this a success for all parties involved. Now, I'm sure everybody's wondering, how do we arrive at these numbers? What kind of a benefit are we going to be able to provide to our members? And really, you can use that as a basis to compare to the RFP results that you already have, as well as what we have historically been providing to our members. And I'm positive that you will notice the difference. I'm positive that you will notice the improvement. And obviously, I'm positive you will notice the cost savings that we are proposing for the benefit of everybody involved. With that, I would like to bring up our consultants. Well, before I bring up our consultants, and I know nobody wants to hear from the lawyer longer than absolutely necessary, but if you want time to digest the article, please, by all means. I'm happy to, I'm here all day. The goal here is to express to you exactly what we want, when we want it, how we want it. Nobody's trying to hide the ball. These negotiations are meant to prove exactly how and when we can provide these benefits at a lower cost. So while you look that over, I'm going to bring up Rob Fitzpatrick from Brown & Brown. He can explain to you exactly what our plan looks like and the benefits and the cost structure that we're proposing.
Good morning, everyone. I am not going to stand up there because I'm going to stand with you, and I'm going to talk to you about this presentation. You need me up there. Okay, I guess I
Try.
All right. You're going to hear me. You're going to hear you, for sure.
Everybody hears you.
Exactly. So, good morning, everyone. My name is Rob Fitzpatrick. I'm the Senior Vice President of Labor and Government Accounts for Brown & Brown Insurance. I'm here with my associates Joseph Fiorello and Diana Kemelak. We are your team that have been working with the PBA and Local 754 leadership to examine and dig into the history of the City of Tampa Medical Benefit Plan, where you've been, where you are today, and we've looked at the city's RFP results and where the city projects you're going. All the numbers within this presentation are from Freedom of Information requests that we've made, and also got the information as a result of the city's RFP. That being said, these numbers are not our numbers. These numbers are the city's numbers. So we're using this so that we start from a level playing field. We're not going to fight over what the number results are, because these are what the city reported to us as the results of their budgets, year-end results of their healthcare claims, and administration, and the RFP results. And can you go to the first page? We're going to give some basic steps about what is a trust, why do we need a trust, the advantages of a trust, and then we're going to talk a little bit about the historical performance of the City of Tampa plan from 2016 to 2018. And then in 2019, we had an introduction to a new plan known as an HRA. As a result of good claims experience with this HRA, there was a cost shift that the members bore the brunt of. So we want to talk a little bit about that. On top of that, then, we're going to get into this police and fire proposal, and then we're going to back up everything with the appendix of all the numbers and calculations. Okay. So that being said, what is a healthcare trust? It's an alternative to your employer's health plan that allows the participants greater control and access and flexibility in developing their own plan design and how to spend that money. That's important. You're going to gain that control of what you want to spend your healthcare dollars on. Right? It's not going to be dictated to you. Participants of the trust appoint a board of trustees. They act, as the attorneys mentioned, as fiduciaries. They act on behalf of all the plan participants in complete transparency, reporting to